In this episode, we speak with Brad Boyd, Principal and National Healthcare Consulting Practice Leader at BDO USA. Brad brings over 25 years of experience working with provider organizations, payers, private equity, and IT companies to deliver high-value consulting engagements that improve care delivery, enhance the experience of patients and providers, and drive operational and financial performance. Brad was recognized as one of the top 50 healthcare consultants leaders of 2024. BDO is a leading global network providing assurance, tax, and advisory services with a people-first culture that helps clients thrive by turning business as usual into better than usual. I'm your host, RJ Lumba. We hope you enjoy the show. If you like the episode, click to follow.
RJ Lumba is the Executive Chairman of Market Insight Media and Managing Partner of GrowthCap. He is the host of Top Consultant, a podcast featuring today's best consultants who advise and provide services to corporations, governments, nonprofits, and other organizations. Executives and key decision makers tune in to Top Consultant to identify the most knowledgeable and experienced consultants for their most important projects.
Brad, thank you so much for taking the time to chat with us today. It's a delight to be with you.
My pleasure. Thanks for having me.
You spent the majority of your career in the healthcare space. That's your sector of focus. Maybe just to jumpstart the conversation for the benefit of our audience, tell us what areas of healthcare are you most excited about?
Right now, I think a lot of our clients are facing some financial pressures like they never have before. There's a lot of payer behaviors leading to denials, the higher costs coming out of COVID. I think one of the potential bright spots, and that really gets us exciting when we have client conversations, is kind of the hope of where technology, automation, and AI can start to address some of the kind of underlying challenges and maybe provide some relief for clinicians, and so they can spend less of their time dealing with paperwork, more of their time dealing with patients, and provider organizations can, automate some of their administrative work that just eats up more of their costs, kind of non-value added tasks that are responsible for billing and getting paid, so that they can shift more of their resources and time and effort to taking care of patients. So I think hopefully automation, artificial intelligence can provide some real relief and have some transformative effect in healthcare. So there's not a conversation we have with a client or prospective client where AI doesn't come up, and hopefully that can be deployed the right way to address some of the problems that are ripe for solutions.
For our audience, everyone is to some degree familiar with the large consulting firms and the big four. There's other hybrids out there between professional services, audit, consulting, et cetera. But how would you describe BDO and how it may be different than some of the other large professional services organizations out there?
BDO did something kind of unique. Like a lot of the large accounting firms, they have an audit business, tax business, an advisory area. So I'm in the advisory space. They had several capabilities in their healthcare advisory team, but the organization recognized the size of healthcare and the opportunity that was across their traditional audit tax clients. To grow a business and to make a meaningful presence quickly, they actually acquired my former firm. It was an entrepreneurial company, 16 years in the making. And instead of kind of going through some of the ongoing kind of organic growth capabilities, they took a different approach. Bought a privately owned, smaller boutique size firm to try to use some of those lessons learned and how to kind of be a little bit more entrepreneurial and focusing the market in really kind of innovative ways, and to try to take some of those lessons learned and apply those to a bigger firm. So we started off with a concentration around management consulting focus in healthcare, but quickly has evolved to trying to support more of all of our healthcare clients in a much more holistic manner. I don't get terribly involved in audit types of businesses, but when there is a client that has a need, even if just a question, understanding some of the regulatory impacts, being able to connect them to someone as a subject matter in a different area very quickly helps us just deepen the relationship that we have with those organizations and develop more of that trust. And I think the entrepreneurial flavor of a startup business that has grown very successfully in an organic process, that's how a small business that had no brand survived and thrived was having a client and taking extremely good care of them and learning what makes them tick, what their challenges are, and helping address those solutions as opposed to just being a big box type of a consulting firm.
Yeah, it's really fascinating how consulting firms are able to grow as a business itself from a startup into something that's acquired by either one of the big firms or, private equity has been involved.
Yep.
I'm curious, like putting your more entrepreneurial hat on to the days of your predecessor firm, if you were able to pin it on one or two things that you guys all did right, what would you say that was?
I'll say it starts with listening. I'm a consultant by background, and we have methodologies, we have wonderful slide decks and capabilities and approaches, but something off the shelf is only going to get you so far. You really need to listen. You learn more by, I like to say, you learn more by listening than by speaking. And clients that have problems or that have goals are very comfortable in describing what they're trying to address and how they're trying to accomplish or where we want to go, but not having any idea of really how to get there. It starts with listening because that gives you a sense of what you're trying to address, be it, fixing a problem or coming up with an innovative solution around a growth opportunity. It really starts with listening as opposed to, okay, we have a transformation playbook and here's the way we do this. Here's how we integrate different practices together. Those tools and methodologies all play a pivotal role, but how you take some of those and listen and adapt those methodologies to each situation that every single client has. And if we've worked with one academic medical center, we've only worked with one academic medical center. They have different dynamics, different governance structures, different systems, different relationships between a hospital and physicians. And really understanding all of those nuances helps you address those problems in a little bit more of a tailored approach. And that's, I think, where kind of the blend of an entrepreneurial firm with the capabilities and scale of a big company. That's where we've been able to take BDO over the last 3.5 years and really expand our footprint in the healthcare industry.
It's hard to recruit the right talent and retain that talent, and it's integral to the success of your firm. How do you go about doing that? And are there certain things you look for in each individual candidate?
So I think there's two things. There's the recruitment and the retention. They're both pivotally important. A lot of our focus, a lot of our resources come down two angles. It's not unique to just our practice. They either come from industry, so from clients, provider organizations, health system, hospitals. So they come and they have an expertise in a particular area. Or they're more like my background, which is more on the career consulting side that really just had to kind of learn the industry and keep on top of changes and dynamics. It really is hard to attract and identify the right capabilities and how someone can say come from industry but have to learn really good management consulting skills, or someone has really good management consulting skills and you have to explain the nuances of different areas of the work that we do. So that is a not easy process, and you really have to do your homework. And a lot of our best and brightest have come from existing relationships, people that might have worked at other firms where we worked with, or might have worked from clients that we worked with in the past. And we just keep in touch with your network and communicate to these folks, whether they're just an industry colleague, a former client, a prospective client. You need to keep in touch with folks. COVID presented many challenges for all of us. We took a little bit of a different approach. We did not have any layoffs of staff. We looked at strategically what are the needs of the healthcare industry when things such as preventative procedures were paused and the financial impact that had on organizations, like higher labor costs, turnover. We focused on something like things that were very immediate, cash acceleration. These organizations aren't treating patients. We have to focus on accelerating the collection of their receivables to keep cash flow going. We took our established relationships with clients and the skills that we had, whether they were consulting or say in a functional area, and we completely changed the nature of our work to provide those organizations with some immediate financial relief. We actually grew our team quite a bit during COVID. So coming out of it, we had more of a loyal workforce because we did not have layoffs and some of those disruptions. And there's never one great way of doing that. And companies had to be pretty unique in dealing with that type of a situation. But a couple of years post-COVID, You can't take any of those relationships for granted because now other firms are growing and their private equity is becoming much more involved in professional services. And now it's about retention. We talk about patient experience in healthcare or provider experience. It's also about the employee experience. I think BDO has been very effective for the team that joined from my former firm. Is a bigger firm has been able to give a lot more training opportunities, formal training, and a lot more career development. So we have focused a lot on those two areas as part of that retention plan. Bonuses and financial compensation, it's important to everyone, but I think more learning opportunities and more professional development are some of those softer skill capabilities that they've been more effective for us than just throwing dollars at a problem. Compensation is important, but rounding out the experience of an employee, I think professional development opportunities and roadmap and training and support to help our staff get there has been much more important than what we could offer financially.
Through this podcast, we speak with many leaders at the top levels of some of the most notable consulting firms. And I'm always very impressed on people management skills. I assume the journey along the way to the executive ranks has not maybe always been smooth, and there's maybe some learning lessons. And it's always, I feel, to a certain degree, people interaction lessons. I'm wondering if you could share with us an insight about something that maybe more junior folks get wrong as they're kind of in the early to mid stages of their career, but there's actually something that's really easy to know and fix if they just looked at a situation differently or approached people in a different manner. Is there some bit of insight or wisdom you can impart on the audience?
I hope so. I think in consulting, people are our most precious resource, and our clients are all people as well. The role of communications at all levels, written and oral, is you can't overemphasize the important nature of that as much. I think we see it. I mean, we can do and have a project that's really, really impactful, do great work. 95% of the work is done. But how you start to package up, whether it's findings or a performance improvement plan or taking a lot of work that you performance improvement work and quantifying the value of the ROI that a client has gotten from that. If you can't package that information up and present it at an executive level, a lot of that hard, really good work that you did, you don't always get credit for it. And we might not get credit for it as a consulting practice or as a firm, but it's also on the individual. And so that individual can really, all of the work you can get 95% of the way. And the communication piece, whether it's written reports or presenting at an executive level, those are skills you don't always learn in business school or in earlier, undergraduate level careers. That's essential in the consulting world, is being able to understand your audience and speak at the level. And today, with just some of the financial constraints in healthcare, you're always in with the CFO. CFOs need numbers and data. And so talking in general terms, if you can't put quantification in real dollars and cents, the potential opportunity or what you're able to accomplish, you're not going to get the credit for the work that you do, even though you might have busted your butt. So I think our team, we focus a lot on training of communication skills, and that is written, that is oral, just to make sure that some of those softer skills that are just pivotally important, it's not just all analytical skills or functional skills in an area. To truly see the value and make the change that you want to have, that buy-in, it's communication. Some of it for middle or younger people in their career, or as they start to drive up, they don't always have the opportunity to do that. So I think they should seek out as many opportunities as possible. Sometimes it's just internally. We have team meetings once a month, and half of those team meetings are internal people giving, case studies of engagements. One is to share across our team the types of work that we've done or an innovative experience, but it's also about giving that individual or that team experience in a psychologically safe environment where they can have a joke or make fun of themselves a little bit, but it's that experience. And so look for those opportunities to volunteer and put yourself out there, but then really, really prepare. Do dry runs, practice in front of a mirror, really talk through it, because literally every single word you say can matter. So when you do get that opportunity, just make sure you prepare for it. Then you'll grow from there.
Could you provide us an example of a client engagement that you worked on and you're particularly proud of how it ended up for the client and maybe for everyone involved on your team as well?
I'm going to go back to COVID. We worked with an organization in New York City, so Ground Zero, a very prominent organization. Going into COVID, patient access, acquiring new patients, retaining patients, making it easier for a patient to schedule an appointment. For example, these are things that as a consumer of healthcare services, we've all struggled with. But this organization had some different challenges. They had a $1 billion loss. They had made massive investments in technology to try to expand their ability to capture new patients and do so in a situation where a patient can, say, book from their phone, just like they could a bank or an airline ticket. And we had got an SOS call because the financial impacts of the pandemic were so significant on this organization. They had made many investments to try to tackle this problem, but their metrics were going the opposite direction in a significant way. And it was through a very close relationship at one of their key leaders. It was just, we don't know what the problem is. Let's just get in the room and figure out how would they approach this. Luckily, we were able to kind of lead the organization down a very consultative process. Before we even agreed to here's an engagement, we engaged their teams. We talked through, here's what we understand what you're trying to accomplish. Here's some of the things you've done here, and kind of dug through the layers of the onion to figure out how exactly we're going to address this. And then once we kind of took a couple of weeks to figure out the approach, it was okay, get this done in a month. And we said, well, you've been working on this for 3 years. We can't solve this in a month, but it took 3 months. The financial impact of this one project led to over $100 million of revenue captured from new patients in a very competitive market where they had a lot of big blue chip academic medical centers. And what made it that we're so proud of is it really took the right knowledge of clinical operations and working with physicians and physician leaders, whether they're a department chair or a C-suite, working with a scheduler in a practice, working with an office manager, this range of different skills, heavy on the finance, heavy on the IT. It was the knowledge of each of those types of stakeholders that you had to be able to talk up or down to and engage in this process is what took 3 years of work that really hadn't moved the needle and got that done in a relatively short period of time. And this organization's CFO dedicated a finance team to just quantify on a week by week financial kind of improvement that was resulted and that was promoted. So the successes started to grow. That was impactful of getting rid of some of the barriers to change. But when we were able to get the leadership aligned on this is the right approach and get them bought in, extensive communication to the various stakeholders, $100 million from a few month project in healthcare is really transformative. And all those lessons learned, we still use in every conversation we have on this particular, talking about expanding access or simplifying access. We've built upon a lot of those lessons learned. We've built upon the foundation of that work, but we didn't scope it ourselves. It wasn't just like these consultants came in. We really engaged with many levels of this organization, put the approach together with them, and then partnered with them to drive a very accelerated process.
It's a great example. We're heading into the tail end of the conversation. I have 2 final questions. One is,
Sure.
Can you tell us about a person who's had a profound influence on you?
I would say both of my parents, to be honest. My parents were very focused on education, and I was fortunate. I went to business school thinking I would get out of consulting, at least get out of healthcare consulting. Business school was an accelerator for my growth, and it was just the focus on education from the earliest days, and that goes back to my parents. Part of the reason I think I'm an effective consultant is that lifelong learning mentality, and I think you can never learn enough, and you can never have enough knowledge. So that would be, I think, education is something that has started with my parents.
Excellent. Last question. Can you tell us about a charity cause or other endeavor that you're passionate about?
Education. Actually, my wife is a special educator and elementary educator by background. And as a family, we've done a lot of work in early education and early intervention. And we've been fortunate to travel around the world. And we've also, at our old firm, we dedicated a lot of our laptops to schools in one Caribbean island in particular. And when we'd be there on vacation, we'd help kids learn how to log into a computer that they thought was like a spaceship. At it started and help in those programs. So I think it goes along with tying back to the importance of education at an early year that my parents instilled.
Excellent. Well, Brad, thank you again for taking the time. It's been a wonderful conversation.
Great. Thank you.